Hello, my name is Fred Vigueras. I'm a sports and spine physiatrist based out of Virginia. I wanted to thank the Academy for inviting me to talk about my practice. One aspect that makes my practice unique is that it is primarily telemedicine based. For those of you who are not familiar with telemedicine, it is the remote delivery of healthcare and also clinical information using digital communication devices. So for my practice, I use predominantly video conferencing to communicate with my patients, and in some cases do some very focused physical examination. And then I also use a patient portal, essentially almost like an email communication style, to help provide care. The other aspect of it is that I am essentially a cash-based practice, so I do not participate with the traditional third-payer insurance companies. Patients who see me will book an appointment with me online off of my website, and then upon completion of the visit, I send them a bill through an app, and then they pay with their credit card or an HSA card, and that's another aspect that makes it pretty unique. Telemedicine. I get this question all the time. Essentially, I just think that it's 2019 and it seems like everything is digital. We do just about everything online or from our phones except for healthcare. And as you guys know, healthcare access is quite limited across the board, and that's pretty much across every specialty. So in a day where consumers prioritize access, convenience, and price, using telemedicine just seemed to be a very easy way to provide value to our patients. But everyone seems to have a cell phone or a tablet or has access to the internet, so telemedicine just seemed to be such an easy way to provide healthcare. How do I use telemedicine in my practice? Well, my practice situation is still a little bit unique in that I don't actually have a physical practice, meaning like I don't have an actual building of where I work out of. I'm essentially 100% virtual. And the way that it works is that people will send me their information like clinic notes, MRIs, injection notes, EMGs, things like that. And they basically will come to me asking for my opinion. So obviously there's limitations because I do not have a physical, I don't have the ability to actually lay hands on them, so I'm not picking up essentially new patients. These are people that have essentially been seen by a million other providers that have had several different opinions, and they just want someone purely objective. So they send that information to me securely, and then they get online with me. I have a secure app that we can FaceTime, and we discuss their notes, and they have essentially an entire hour to discuss with me anything about their clinical history and just ask me general questions. In terms of the benefits of my particular practice, I think the big thing is convenience. Essentially, I set up hours every single day, starting at 8 in the morning all the way up until 9 o'clock at night. So people can see me whenever it's convenient for them. It also obviously corresponds with my personal schedule on when I can see patients. We already talked about the access issue. If they have any follow-up questions, they typically will email me or send me a text. And a lot of times, I think physicians are really skeptical about being that accessible. But I've been practicing telemedicine in the form of email with patients for several years, and it's very unusual for a patient in my practice to kind of abuse that or do it so much to the point that I've thought about completely shutting off that access point. If I've ever had that particular patient that had that many questions, that's kind of an obvious sign that that's someone who needs to formally come in and we need to have a dedicated session to answer those set of questions. But the other aspect of it is the transaction. So because I am not insurance based, there's no pre-authorization. They simply punch in their credit card information into the app that I send them, and then it just goes directly into my checking account. So it's one of the beauties of having a cash-based practice is that there's no third party between me and the patient. In terms of limitations or restrictions, as I said, in my current style of practice, I'm a 100% virtual, so I don't have the ability to physically lay hands on patients, but because of that, I'm very selective about the particular type of patient that's appropriate for my style of practice. So that's, I think, another thing I should highlight is that I don't accept 100% of my patients. I talk with them and make sure it's a good fit. And from there, that's how I decide if this particular model should work for them. I think the other potential drawback is the accessibility, and in terms of the hardware connection. People's internet access can sometimes vary, but also their connectivity. So I do run into people dropping calls and having to reconnect with them online, and that can be frustrating for both me and the patient at times. In terms of the last potential and probably the most important one is just the human aspect of things. It's definitely a trade-off because there is value in being present with the patient and being able to formally lay hands on the patient. I think that does change the relationship. However, on the flip side, because my time is so dedicated to them, I have a 60 minutes purely to focus on them. I found that I've had much more in-depth conversations with patients, and I'm not really restricted by someone knocking on my door or having to watch the clock because I've already allocated a certain amount of time to that patient. And I think that really translates to the patient. They seem to be very, very happy and very, very receptive to that aspect of things. But again, the human aspect of things, there's the physical contact should never be discounted because there is a difference. But overall, I'd say it seems to be working well despite the trade-off. Some of the challenges that I've run into over the past year, it's basically just being a first-time business owner. I've never owned a business, so kind of doing the legwork to understand how to structure the company and understand kind of the in and outs of being a small business owner. But from a technical standpoint, there was a lot of research that I had to go into about learning telemedicine law, learning about HIPAA compliance and how electronic communications need to be done correctly, finding and researching an electronic health record that fit my practice's needs, understanding how to market a practice. So a big portion of my practice is essentially online, so I had to build a website, come up with content. I try to be active on social media, so kind of that day-to-day stuff is actually a lot of work. I'd say lastly, learning or finding a way for a transaction to occur by credit card, or so finding a system that would actually integrate the charging portion of things where I could actually be paid for my services was actually a little bit more complicated than I expected. But fortunately, I found a workflow that seems to do well. It has its glitches, but overall, it's as a young business owner and kind of a first time attempt at this type of practice, it seems to be working pretty well. How's it going? It's going okay. It's going well. I say that with pause because it's not this practice is not my primary mode of income, but it is starting to build. And I'm being 100% honest with you guys. It's not like I replaced my entire salary with this practice. This is essentially kind of like a side gig for me at this point. But at some point, once my my non-compete runs out, I plan to have a physical practice where I will see patients more traditionally, but still cash-based. But again, the telemedicine is going to be a big portion of the practice and how I follow up with patients. But it's in terms of reception, everyone seems to like the model from my peers. But in terms of patients, they really like it. But I think that there's still kind of like a lot of skepticism because honestly, it's a little sketchy. Seeing your doctor, quote unquote, online, even though there's the obvious value that I can spend way more time with you, it's just not traditional. I think the other challenge has been being a cash-based model. Most people use insurance, and even though their particular plans sometimes cost them more to see someone for their condition versus seeing me up front, I think just that simple behavior change, I should say, is really kind of a big bridge to overcome. Lastly, I would say that I think telemedicine is coming up, and we're still at that phase where like people were hesitant to buy things online. So eventually it should come along. But once my physical practice actually gets started, I think that's going to make that transition a lot more seamless. Some last thoughts for you guys. It's been a great experience trying to think outside of the box. As physicians, I think we are brought up in the box for so many years, and it's really very hard for us to look at other things and essentially make that leap. Just from a personal standpoint, when I made my decision to leave a secure job, it was one of the biggest decisions I ever made. But it really kind of forced me to dive into this model, and there's income coming and it's building, but more importantly, it kind of gave me the confidence to jump on my ideas. This has been something that I've always wanted to do for the longest time, but honestly, I was just really very scared, and it's still kind of scary. But just knowing that this model is starting to get some traction, I think as physicians, it's important to think about these type of things, because right now we're very attached to who pays us, and the more independent that we become, I think our financial stream of income needs to be a lot more diversified. So we need to look at other ways to essentially make money and to survive. But it's still a process. By no means do I think I've figured it out, but it's been great. I wanted to thank you guys for the attention and listening to me talk about my particular model of practice. If you guys want to check out my website, you can go to www.sportsandspine.com. You can also see my Facebook and my social media tags on the bottom. You can always email me at drfred, that's drfred @movesportsandspine.com. Anyhow, I wish you guys luck. Again, don't hesitate to contact me if there's any questions. I'll see you guys later.